important elements, but it's not a revolutionary change in the healthcare system. It was a negotiated outcome between the Commonwealth and the states, and as any negotiated outcome, it has elements that are progressive and others that are more restrained in their ambition.
Ultimately, that package is just politics at work. The real issue is actually funding aged care, and the Feds already control that and they haven't gone there. They haven't gone there because it costs them money. To split it, and just to flip it 60-40 is, and these guys have got to be a bit careful because their bosses are in camp of it, but it is just politics. It has done nothing for the system at all. Zero. Local hospital boards were in the 80s, and we've just gone back to the future there, round and round the circle. It will do nothing to improve healthcare, other than primary care. I think those points been made. I think there's some merit in that.
I mean, you're being a bit unfair. Local hospital boards are governance structures. There's nothing magic about a board. It's just a governance structure. Back in the 80s, they administered hospitals at historical budgets and were funded historically. We're now going to have activity-based funding. So they're actually going to be run much more like an independent...
Couldn't agree more. DOT funding is great, but then you'll find all the carve-outs. We haven't got there yet.
Yeah, well,
wait till the carve-outs, because if you want to get into a bit of detail, but the DRGs will sit in the major publics and then that'll be it.
When I've talked to patients and members of the public trying to understand how they access our health systems, they have no expectation that their GP is going to do that. They want to go to a specialist for things that, in my experience, a GP would be well able to handle. And indeed, currently, many of them get around the system that stops them being looked after long-term by a specialist by a system where the specialist gets the GP to refer them back every year for a checkup. So we've created lots and lots of mechanisms to get around the systems that are intended to do exactly what we're intending to do again. And my nervousness is that whilst we're creating something that I think should work, we haven't really explored with the public and the patients what it will mean differently for them. What I hear from people who attend the Alfred and work around my part of Melbourne is they expect to see the specialist. That's what they're paying their taxes for, and if they don't, they'll go and see them in the private sector.
The benefit in this package is the transparency. So all the states, with respect to pricing, will share their information, can be clearly measured, it will be obvious as to who's more expensive than others, both for large metropolitan hospitals and for smaller hospitals. The block grant will be subject to the consideration of the new authority. So the transparency is important.
At the higher levels, in terms of some of the funding and management, even at a federal level, the National Funding Authority has now been passed to Treasury. Health is going to have a component, and Medicare Australia sits over in Human Services. So even with at a federal level, three main departments have components of the system as responsibility. So, some of the questions about, our capability to integrate go to the very highest levels of government as well as to the lowest levels of the system. And they'll be the things that will challenge implementation.
But we don't want to end up like America, where you can have just either fantastic healthcare or almost no healthcare. I mean, I think we still have a fundamental commitment to the healthcare as, to a certain extent, a basic right, and that we need to protect that.